Good morning, everyone. You are very welcome to the Healthy Weight for Children webinar. The panel would be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. I will now hand you over to your host, Dr. Sarah O'Brien, National Lead Healthy Eating Active Living Programme. Thank you.
Good morning, everyone, and welcome to our webinar today. We're delighted to have you all here with us. The webinar today marks a new phase in our Healthy Weight for Children work, which started back in 2017, and we started this journey with colleagues in the Healthy Childhood Programme, Dr. Phil Jennings, Carmel Brennan and Mary Rafferty, and we're delighted to be continuing that journey today with and into the future with Dr. Abigail Collins, who's the clinical lead for the Healthy Childhood Programme currently, and Anne Pardy, Programme Manager, as well as the many colleagues across the health services who have an interest in child health, health promotion and obesity prevention. I hope you very much enjoyed the session today. We've had a great time putting it together. We have an excellent programme lined up, kicking off with Dr. Celine Murren from UCD, who will take us through the latest Childhood Obesity Surveillance Initiative results for Ireland. This will be followed by my colleague Veronica Conti, Dr. Ida McDonough and Fiola Murphy, who will give us an overview of the next Healthy Weight for Children action plan, which will cover the period 2024 to 2028 and how it was developed. And we will then move to a panel discussion on a topic that came up a lot in a previous webinar we held, which is about talking to parents about how to talk to their child about weight. And that will be very exciting and interesting. As we go through the morning, we would love to hear your questions and observations, so please do use the Q&A function. So I suppose we know that what surrounds us shapes our health. Factors like how easy and affordable it is to buy nutritious food, how our shops and streets are designed, the opportunities we have to be active every day, and how foods are marketed all play a part and can be improved by national policy and actions across a wide range of areas when it comes to our health and well-being. Many of these areas are not directly within the control of the HSE. However, we do have an important role to play in promoting child health and preventing obesity. The Healthy Weight for Children action plans provide us with a platform for coordinating and connecting the multiple HSE services that have a role here to strengthen our organisational capacity for child health promotion across the many routine contacts that the health services have with children and families. And they also provide us with a platform for collaborating and coordinating with external partners to promote and advocate for change across the range of policy, legislative and practice areas that we need change in to create healthier environments where every child has the opportunity to thrive. And these action plans can only be delivered through collaboration and a commitment to a shared objective, which is what I suppose today is about in some ways is you know, starting that conversation with you all around what that shared objective is. So just talking about collaboration and a shared objective, I'd like to invite Dr. Abigail Collins, the clinical lead for the Healthy Childhood Programme, to share a few words with us. Unfortunately, Abby cannot be with us today, but she has kindly recorded a message as we start out today.
Hi, I'm delighted to welcome you to this Healthy Weight for Children webinar. This webinar is a joint initiative between the Healthy Eating and Active Living Programme and Child Health Public Health. Unfortunately, I'm not able to attend live this morning, so sincere thanks to Sarah, our wonderful programme lead for Healthy Eating Active Living, for chairing the webinar this morning. Approximately 1 in 5 younger children live with overweight and obesity, and it rises to approximately 1 in 4 for adolescents. We also know that we see higher trends amongst children and adolescents living with poverty and in areas of disadvantage. I am sure we all look forward to hearing the findings from COSI Round 6 study to give us the best and most recent information in this space in Ireland to help guide our future work. It's well evidenced the impact overweight and obesity has on our general health, both now and in the longer term, and so all our combined work to support families is critical. It is also well documented that what surrounds us shapes us, and factors like easily available and affordable nutritious foods, alongside actions around the marketing of unhealthy foods, are key components of sustainable solutions. To this end, both Sarah and I look forward to our continued work both with partner organisations outside of the HSE as to how to support and tackle some of these wider issues. Equally importantly, we look forward to our closer working with colleagues across the HSE within the Healthy Weight for Children regional groups and the development of a new HSE steering group for Healthy Weight for Children. Across the HSE, we're developing the Healthy Weight for Children Action Plan 2024 to 2028 and look forward to finalising that and using it as the tool to support sustainable, effective work over the coming years. This collaborative work will both help us from a prevention perspective, but also to support parents and families currently living with overweight and obesity. To this end, the recent booklet published, Talking to Your Child About Health and Weight, will hopefully really support families and practitioners, and I encourage you all to use that resource. I don't want to take any more of your time this morning other than to say thanks so much for attending. I hope you enjoyed the presentations and discussion, and I want to sincerely thank all the collaborative work that has been undertaken with you all to keep a focus on this critically important area of work. I hope you enjoyed the morning.
Thank you, Abby. Some really inspiring words there in terms of where we need to go over the next number of years. I'd now like to welcome Minister Colin Burke, Minister of State for Public Health and Wellbeing and the National Drug Strategy, who is kindly taking some time to record a message for today's webinar. Child health and obesity prevention are key priorities for the Department of Health, so it's really welcome to have his input today in his new role.
Good morning, everyone. I'm delighted to speak to you about the 6th report for Ireland on the Childhood Obesity Surveillance Initiative, COSI. And my thanks to Dr. Abigail Collins and Dr. Sarah O'Brien for the invitation. The development of effective policies depends on the availability of robust data, so the population-level surveillance in today's COSI report is crucial. It's reassuring that the majority of our primary school children aged between 7 and 11 years are in normal weight, and that the prevalence of childhood obesity in Ireland has remained static since the COSI project started in 2008. This is despite recent challenges in lifestyle and health behaviours brought on by the COVID-19 pandemic. Nonetheless, it's concerning that the data continues to show higher levels of overweight and obesity in areas of disadvantage. There are many initiatives in the programme for government that the Department of Health, under the Healthy Ireland framework, is implementing to address this divide. My department is taking a cross-sectoral approach to improving health and well-being for all children through the Obesity Policy and Action Plan and other strategies such as the EU Child Health Guarantee and the First 5 strategy. For example, in collaboration with the HSE, FSAI and Safe Food, we created nutrition standards to support the menu development for the Hot Free School Meal Scheme. The Department of Education promotes healthy eating education in the school curriculum with the Food, Dudes and Incredible Edibles initiatives. These are excellent programs that educate children about fruit and vegetables and teach them how to grow food. In addition, many schools participate in the Active School Flag programme, which encourages regular physical activity for primary school children. These initiatives provide an important foundation in healthy behaviours for children and will support their healthy development. I also note that the majority of primary schools that participated in the COSI study are doing well in limiting exposure to foods or advertisements of food that are high in fat and sugar. This is an important intervention which positively impacts food consumption behaviour. Outside the school system, we're supporting people and communities to make healthier food choices. Together with the HSE and local authorities and agencies, the Department of Health has set up 19 Sláinte Care healthy communities nationwide to provide health and wellbeing services. There are now 19 community and nutrition workers delivering initiatives such as Healthy Food Made Easy and the Safe Food community food initiatives to promote healthy eating. They are teaching valuable life skills not just for individuals but for parents and families. These programs are just a few of the many strands of work underway to reduce and prevent overweight and obesity. By encouraging children to make healthier food choices now, we can reduce their risk of life-altering diseases later in life, as well as reducing the burden that these diseases place on our health services. I'm very hopeful that as these programs develop and we continue supporting and promote healthier behaviours across sectors, and future COSI reports will illustrate a decline in the rate of childhood overweight and obesity. We can, however, only achieve this by working together, and I want to thank the HSE and other partners here today for their ongoing collaboration. I also want to thank all the health professionals and researchers for engaging with the data and wish you well as you use it to inform your work. Thank you.
Thank you very much, Minister. So Ireland is one of 13 countries who've been participating in the World Health Organization Europe area childhood obesity surveillance initiative since 2008. And over that time, our participation has been managed by the National Nutrition Surveillance Centre in UCD. So I'm delighted this morning to welcome Dr. Celine Murren, Associate Professor and Deputy Director of the National Nutrition Surveillance Centre, to share with us the results of the research published today. Welcome, Celine.
Many thanks, Sarah, and good morning, everyone. So I'm just going to share my screen with you now. Okay, so good morning, everybody. I'm very pleased to be able to share with you these key findings from the most recent round of the Childhood Obesity Surveillance Initiative. I'd first of all just like to thank my colleagues, Professor Cecily Kelleher, who is the Principal Investigator of the COSI initiative in Ireland, and also Orla Kilduff, who has been the Project Manager for COSI for the most recent round. And Orla essentially has done all the hard work. She has managed the data collection, done the analysis, written the report, and essentially prepared these slides for me today. So really, she should be here instead of me. And I just want to thank her for all of the hard work that she has done to date. So as we all know, the problem of obesity has been challenging for several decades now. This slide will give you an indication of the prevalence of childhood obesity at a global level. With girls, we are seeing very high levels continuing in lots of areas of the globe. Obviously in the global north, where we have seen this problem and challenge for decades. But more worryingly, we're starting to see the levels of childhood overweight and obesity increasing in the global south. And in regions such as in South America, where we have double burden of undernutrition, but also in relation to overnutrition as well. So countries such as Mexico, where we're seeing very high prevalence of overweight and obesity in children, up on 40%. And also in areas such as the Middle East, where we're looking at countries such as Kuwait, and Qatar, where we're seeing close on 50% or over 50% of girls living with overweight and obesity. And I suppose the problem is one that is affecting lots of different areas. And in Europe in particular, this data shows pooled data collected by the Lancet, which is looking at adults. And it's showing over a period of 1975 to 2016, the prevalence of underweight and overweight and obesity. So the darker areas, the orange and the red areas, are showing you the prevalence of overweight and obesity. The top left graph is the northwestern European region, which is where Ireland is located. And you can see, obviously, we have had a significant problem and continuing to have a problem with adult overweight and obesity, which is continuing to be a challenge for our areas, but also we're seeing rapidly increasing rates in other parts of Europe, and particularly in Central and Eastern Europe, where the rates seem to be accelerating. Looking at childhood obesity in children, we're very fortunate to be part of the Childhood Obesity Surveillance Initiative, as Sarah mentioned. And we can see that the most recent, or the previous round of COSI, which was round 5, allows us to be able to look at the prevalence of children living with overweight and obesity across Europe using standardized measures. So within COSI, it's initiated by the World Health Organization. Every country uses a standardized protocol, and our data then, once we've collected it in different countries, is then distributed to the World Health Organization, and we're able to do some really useful and important pooled analysis comparing different countries and different parts of Europe. And that enables us then to really look at policy measures, because obviously different countries are experiencing different aspects of their political status. They may be introducing new regulations or policies. There may be changes in terms of demographic shifts. And with this data, we have the ability to be able to monitor those trends over time. So you can see the green arrow there indicates where Ireland sits within the prevalence of childhood obesity in the previous round, in round 5, which was almost 25% of those children of age 7 to 9 years. But we obviously have other countries, such as in Cyprus and Greece and Spain, whereby the prevalence of obesity is up on 40% in children. So again, we still have a major problem on our hands, which has not really been tackled fully in lots of different parts of Europe. So looking at COSI in Ireland, again, we've been very fortunate to be we were part of the initial round of the World Health Organization initiative in 2008, and we have conducted subsequent rounds in 2012, 2015, 2018, and most recently in 2022. We were initially designed or targeting the year of 2021 as part of our follow-up program with COSI, but obviously with the COVID epidemic, we were placed under restrictions, and obviously our schools were under restrictions, so we had to delay collecting the data by a year. We were a little bit concerned or a bit nervous about going into schools initially following the pandemic, but we actually had done a preliminary piece of work engaging with principals of schools just to see what their sense was of conducting this type of work in COSI. And they were very pleased to be able to want us to get back into the field and to be able to do this work. So we were very fortunate to have really fantastic cooperation from all of our schools. So the design of COSI, as I said, it's a standardized protocol across Europe. In Ireland, we use what are called sentinel schools. So this is basically a sampling frame of schools which were originally designed to be representative of primary schools in Ireland. So we are able to have a sample which represents schools of varying different size. So obviously we've got some schools where there's 2 classroom or 2 teacher schools, and then the very large primary schools. The schools are located in both urban and rural areas, and obviously we have schools that are living in DESH areas or in non-DESH areas. So our sample frame is about 187 schools, and some of these schools will have participated in every single round of COSI, and then some of them may have maybe not participated in one round, but then may come back in for another round. And the schools, basically, the protocol within Europe is that 7-year-old children, mean age of 7-year-old, are measured throughout Europe. But in Ireland, then we've also decided to include some older children. So we include children from 1st and 2nd class, but also from 5th and 6th class in our sampling and in our measurement. The principals are invited to participate in COSI, and then once they consent, we send a letter out to parents and ask them if they're willing to consent to their child to participate. And once they've consented, then we organise measurements. Our team of field workers go to the schools and then conduct the physical measurement in the school. In addition to that, then we also have 2 other instruments where parents are invited also to participate in a family survey, and that asks questions about various different aspects in relation to their child, their levels of physical activity, food behaviours, sleep, etc. And then the school also is invited to complete a school survey, which gives us some indication about the school environment. So today what I'm going to present to you are the results from the measurement or the examination part for the child, and also some of the key findings that we have observed from the school survey. The family survey we will be publishing at a later date because we're still conducting some of the analysis on that data. So in relation to our findings, we're very pleased overall that the participation rates for COSI have not actually been negatively affected, particularly by COVID, because again, as I said, we were a bit anxious that maybe schools were not willing to participate. So in fact, what we're seeing is 65% of our schools have continued to participate. A slightly higher proportion was observed within the DESH schools. So again, they're very keen and obviously are very clearly understanding the importance of monitoring levels of weight status and height status in children in these schools. What we see again compared to the previous round, while there was a slight decrease in the total number of schools, again, it's still we still are maintaining a very good level of participation in our schools. And then in terms of the parents consenting to participate, we have just nearly 61% of parents who have consented to their child to participate. And that has resulted in a final sample of about 5,000 children who were actually measured as part of this round of the COSI survey. So in terms of our results then, so this first slide is actually describing the prevalence of overweight and obesity according to the class that the child was in and according to their sex. So on the figure on the left-hand side, if you look at the extreme right, which is highlighted in red, you can see that the overall prevalence of children living with overweight and obesity is about 17.7% in these schools. And then if you look according to the different classes, you'll see that there are gender differences, particularly observed in second class. So again, we're continuing to see girls with a higher prevalence of overweight and obesity than boys. When we start moving into 5th and 6th classes, we don't necessarily see the same differences according to sex. However, we do see that there is a difference in terms of the 5th class children in particular, having a higher proportion of children living with overweight and obesity overall. We also measure underweight with children, and we can see that that has actually shown an increase from the previous round of COSI. So we're now looking at a prevalence of about 9% of children with underweight as part of this monitoring program. So when people are very interested to look and see whether or not we're seeing changes in relation to the schools who are experiencing or are part of an area living in disadvantaged. And we're seeing that overall there is continuing to be a stark difference between those schools that are located in a disadvantaged area. So again, looking at the extreme right-hand side, you'll see that the prevalence of children living with overweight and obesity is 25% compared to those who are living in a non-disadvantaged area, which is about 16%. Again, the earlier classes, we don't necessarily see the same stark difference, but it's in 5th and 6th class where we really are starting to see a very distinct difference between the children from disadvantaged schools compared to those with non-disadvantaged schools. So again, 32% of children in disadvantaged schools from 5th class compared to 17.6% in those non-disadvantaged areas. When we then look at the location of the schools in terms of their urban or rural location, in fact, what we're not actually seeing significant differences across these locations overall. In the extreme right, you can see there is a higher prevalence in rural schools at 20%, but this is not statistically different from the other schools based in urban areas. And you can see that over the different classes, that percentage seems to fluctuate between urban and rural areas. But again, there's no statistically significant difference between the location of the school. These figures show you the trend data that we have. Again, because COSI was in Ireland in 2008, we're able to monitor this data over time. If you look on the graph on the left-hand side and focus on the yellow or the green line, the trend line, this shows you the total number of 7-year-old children. So this is just first-class children. These are children where we're looking at the prevalence of overweight and obesity. And you can see we have come from a prevalence of about 21.6% down to 17.1% in the most recent round. There has been a plateauing effect, but there does seem to be a little upswing, a little inflection overall, particularly in relation to boys, which is the blue line. We're continuing to see girls having a higher prevalence of overweight and obesity compared to boys in first-class children. If you look at the figure on the right, this is looking again at trend data, but now comparing the schools who are designated as DESH versus non-DESH. The blue line on the graph is the DESH schools, and these are schools who are always designated as DESH. Some of you may be aware that in 2022, there was a change in the classifications of schools designated as DESH, and so there's been an increase. So we've separated these out, and you can see that the blue line is those that were always experiencing disadvantage, and then the grey line is the schools that are essentially always designated as non-disadvantaged. And again, you can see that that gap persists. There hasn't been, unfortunately, a narrowing of the gap between the schools that are designated as disadvantaged versus non-disadvantaged schools. So looking at the data from the schools, so this again is information provided by the school principals in response to certain types of questions that were asked about their school environment. So looking specifically at the food environment, what we see, as the Minister mentioned before, that most schools do not include or allow any type of advertising or marketing of energy dense or nutrient poor fruit and vegetables in their schools. We can see that most schools, which again has been maintained, thankfully, that schools don't have a vending machine as part of their school on the school grounds, and also that 100% of the schools include nutrition education in their curriculum. We're also seeing that 93% of schools have no sugar sweetened beverages available, but 7% obviously do. We see that 22% of schools do provide free fresh fruit to their students, and 86% have no savoury or sweet snacks available. But then we have 14% that do have savoury or sweet snacks available to their schools. So overall, we have 7 out of 10 children where fruits are not available, 8 out of 10 schools where there's no vegetables available. And again, we're continuing to see this challenge of schools where children have no access to free, fresh drinking water. And that has been a continuous problem that we have seen in schools over several rounds of COSI. In relation to the physical activity and health promotion environment, we see that 100% of the schools are including physical education in their curriculum. We have schools reporting that they are providing 60 minutes on average of physical education per week. And that ranges from about 40 minutes to 120 minutes in some schools. Almost all the schools will have reported that they organise health promotion initiatives for the class. Again, we don't have detail on what these types of initiatives are, but they are indicating that they are provided in schools. 84.7% of schools have an indoor gym for children, and 100% have outdoor play areas for children. Again, we don't have detail on the size of these types of play areas, whether they're tarmac-adant, whether they're astro, any of that type of detail. It's just giving us these indicators to show that this type of opportunity for physical activity is available in the schools. So in summary, what we're seeing is, broadly speaking, a stabilization of the prevalence of overweight and obesity, and there doesn't seem to be a major impact on COVID-19 on children's health behaviours as was anticipated, or certainly it's not having a visible effect on the prevalence of overweight and obesity in children. The higher prevalence continues to remain in girls, and we are seeing this again in younger children. The first and second class children is where we see that difference between boys and girls. Again, there still is that persistent distinctive difference between disadvantaged schools and non-disadvantaged schools, and that does seem to increase with age. So we start to seeing it much more notably so in the 5th and 6th class children. In terms of schools' environments, largely schools seem to be very positively disposed, and we know that from speaking to schools. They are trying to include lots of different initiatives around healthy eating and physical activity, but yet we're still seeing, despite all of the schools trying to do their best in this area, that disadvantaged continues in terms of the prevalence of overweight and obesity. In terms of our policy implications, you know, we could probably be here for another whole seminar talking about how policy could change and improve the prevalence of overweight and obesity in children. We know that some of the key issues are in relation to things like provision of healthy foods, such as fresh fruit and vegetables, and also provision of free drinking water for children. Increasing physical activity in the national curriculum. We know the new national physical activity guidelines. We should be seeing much more physical activity included in the curriculum, where children are given every opportunity to be physically active during their day. And really, we need to be striving towards meeting our international standards for physical activity. We know, obviously, there's lots of work being done at the Department of Education. You know, they have their Wellbeing policy statement and framework for practice. And obviously, we have the European Child Guarantee Action Plan. And we need to be ensuring that these are implemented. So we need to see whole school approaches. So it's not just about specific pieces of education around nutrition or specific pieces around physical activity. It's a whole school approach that is required in order for us to really support children and their families and the wider community to ensure that they're given every opportunity to have a healthier lifestyle. And specifically, I suppose, in relation to the work that we're doing in COSI, we would like to be able to see with the new school meals program being introduced that there is an allied monitoring system to ensure that we are seeing that school meals that are being introduced are being done in a fair manner, that they are equitable for all children in all schools, and also that they are being provided with a healthier option. And that's really critical in this particular space to ensure that the food that is being provided to those children is a healthier option. So with that, I just wanted to thank our colleagues. Thank you, Sarah O'Brien in the HSE and Veronica Conti. I want to thank our colleagues in the Department of Health and the Department of Education and Skills, and our regional office for Europe in the World Health Organization. Most particularly, I want to thank all of our schools who have maintained you know, their diligence in this area and really have been fantastic in terms of ensuring that our children are being you know, looking at these children as being such vital parts of our society and our community, and making sure that their health is so important for their education, and also more particularly for the teachers and parents who have agreed to participate in this study. And finally, just to thank our NNSE research team, who were very a core part of the work that was done to ensure that we have this data for the COSI initiative. So many thank you.
Thanks. Thank you, Celine, for that really interesting presentation. We have a number of questions into the Q&A there, so I'm just going to maybe summarize. There's a couple of themes, you know, just in terms of consent, just a couple of queries around nutrition standards, and yeah, just a couple of queries around, you know, some specific elements of the data collected. So I might maybe just start with that consent question. You were saying there, you know, in your data that you kind of 60% of parents consented. I suppose some people are wondering, you know, why you think that it's at that level, and does that have any impact in terms of the results? Maybe are you know, parents of children who are living with overweight or obesity more likely not to consent?
Yeah, I mean, I do think obviously there is a challenge with this area in relation to trying to capture every single child. And I mean, in Ireland, we have the opportunity for parents to consent to this study and for the child themselves to assent. So we've 3 levels of consent, essentially: the principal, the parent, and then the child as well. And so, yeah, there may be an issue in relation to this. And we know that really, I suppose the figures that we're presenting today are probably a best case scenario, because we know that children who are likely to be living with overweight and obesity are probably less likely to want to consent to this type of measurement. But at the same time, we do have parents who understand. We have done some work around this. Parents do understand the importance of this monitoring, to ensure that we are looking for what is the best way to improve our child's health and growth and well-being overall. But yes, in response to the question directly, there may be an impact in terms of the response rates for parents. But again, we're seeing that it has maintained a reasonably high level over the rounds of the COSI surveillance initiative since 2008.
Okay, thanks very much, Celine. There, another query, I suppose, specific to this report is, so just in relation to what say 80% of schools had no savoury or sweet snacks available, and there was one query whether that looked at what foods are brought in from home and eaten in school versus maybe what foods are provided in the school.
Yeah, so we don't have the detail, unfortunately, of the type of food that's being provided by the school. We're quite restricted in terms of these indicators that were captured because this is a standardized protocol. So obviously every country in Europe will have a different approach to food provision, whether schools children bring lunches into school. So it is really designed as a very top level indicator in relation to food in the actual schools themselves. And I do think it is something that we are seeing changes and starting to see a shift in relation to the types of foods that are being introduced. We know that lots of schools in Ireland have healthy eating policies, and there's been significant work done on that as well by our colleagues in the Department of Health and the HSE. But we don't know necessarily whether or not that is actually about food provision in the school as opposed to what's been brought in as part of school lunches.
Okay, thanks. And just another, I suppose it's a comment and a question, just in response to the statistic in relation to 25% of schools or principals reporting that they have no access to free drinking water. The comment is saying that all schools have to have potable drinking /drinking tap water available, and that means water that is compliant with EU drinking water regulations. And they're wondering, you know, in responding to that questions, were principals maybe thinking about free bottled water, or do we have any sense of what they're referring to when they say that they don't have access?
Yeah, I mean, again, it's a fairly straight question in the sense that it's access to free drinking water to children in schools. So again, it depends, I suppose, on what we don't investigate it per se. We don't necessarily look at that ourselves. We're very much reliant on the principal's report of this. So it may be that there is a misunderstanding in terms of what's been asked as part of the question.
Okay. I'm just going to, Celine, I know you've done some work on this before, and it's not specific to the COSI data, but there are a number of queries coming in relation to the nutrition standards and school meals. So I suppose would love to hear your thoughts on it, because I know we've had conversations about it and about the whole piece around monitoring and audit and how we can, you know, ensure that the policy is having the effect it's having. But I suppose broadly for the audience here to know, you know, the concerns that you're raising here are concerns that have been brought to the attention of the Department of Health and Department of Social Protection in terms of whether, you know, the school meals providers are actually providing food that's in line with the nutrition standards, and we know that they are looking at that and looking at ways that they can strengthen the monitoring and quality control. But at a very practical level, I suppose the funding for the school meal schemes goes from the Department of Social Protection to schools via a contractual arrangement, and then schools make their own arrangements in terms of who they contract or how they coordinate that food provision. So there is absolutely a recognition that there's a need to ensure that this what is, I suppose, from a child poverty and a EU child guarantee perspective, a positive initiative, that it doesn't have inadvertent impacts in a different way. Have you any thoughts or comments you want to add?
Yeah, I mean, I think, you know, we have tried ourselves before in terms of trying to look at this and trying to actually capture what is being delivered at schools. Now, with the new hot school meal schemes, things have changed slightly, but it is very much up to the individual schools to decide whether they want to have a school, what type of provider that they want to have in relation to that. And so it varies, it is variable, it is, you know, the standard is going to be different. And again, we've seen from the schools, just even the understanding of what does it mean for a meal to be healthy, or what does it mean for those types of foods to be healthy. And so it's really challenging for schools to be able to do that, because they're also looking at things like waste, they're looking at accessibility. So there's lots of different factors at play here, and it becomes very complex very quickly. I do think that we should be looking to see whether or not we could have a better standardized procurement type of procedure involved with schools that would make sure that, you know, schools are obliged to adhere to certain types of groupings of foods or categories of foods, and that would really help to make it more equitable for the various different schools that are participating in the programs. But there's a significant piece of work, I think, that needs to be done on this. And I think it's great to see that it's, you know, this is absolutely at the center of this is child poverty and food insecurity, which is really important for children. But we want to make sure that we have to try and tackle multiple different factors at play here in relation to child health and well-being. So I think it's a really good opportunity, but we really need to be implementing it in an appropriate manner.
It's great, Celine. Listen, thank you very much. I just have got a little note to say we're running a little bit over time. So there are a lot of other questions in, but we're not going to have a chance to answer them live. But Celine, you're staying with us, and maybe you'll be able to, you know, respond to people directly. Some of them are quite technical questions in relation to the research. So thank you very much, Celine, for a really informative discussion. So now we're going to move on to focus on the Healthy Weight for Children Action Plan 2024 to 2028. We'll hear first from Veronica Conti, who's a project manager with the Healthy Eating Active Living programme, on the process for developing the plan, and then from Dr. Ida Nick-Donica, who's a Principal Medical Officer in CHO1, and Fiona Murphy, Child Health Programme Development Officer from that area, also on the work that they have done at a local level that puts you know, a spotlight and a focus on child health and obesity prevention. So thank you very much, Veronica, Ida and Fiona, for being with us today, and I'll hand over to you.
Thank you, Sarah, for that introduction. I'll be presenting today on the development of the Healthy Weight for Children Action Plan, which general theme of today's webinar was a very collaborative approach, as you'll see. So just to give some background, some policy context, back in 2016, looking at the global stage, the World Health Organization report on the Commission on Ending Childhood Obesity was published. At the same time, in Ireland in 2016, we published the Obesity Policy and Action Plan, A Healthy Weight for Ireland, which looked at the population as a whole. Putting an early childhood lens on that national policy, in 2019, the Healthy Weight for Children framework was published, and that looked across government with a special focus on the 0 to 6 years. Putting that into practice, the Healthy Weight for Children HSE Action Plan was published in 2021, and that looked specifically at what the HSE could do to implement that framework. And that was put together with a group that represented child health, and health promotion and improvement, health and well-being. And just to note that you can see a gap between the 2019 and 2021. Here, the development of that plan was impacted by COVID-19, and the implementation of the previous plan was also impacted by COVID-19 and the 2021 cyber attack. So that's how the plan fits within national policy. It also fits within the model of care for the management of overweight and obesity, which sets out how healthcare for children and young people and adults living with overweight and obesity in Ireland should be organized and resourced. So the action plan provides guidance for implementing levels 0, 1A, and 1B of the model of care for children and young people. So you can see how that fits within the end-to-end model of care. It is the foundation of the model of care. Here, looking at health promotion and community programs, it addresses actions around general practice and primary care, be that training, etc., and community specialist obesity MDT, setting up those teams, their actions on that. And underpinning all of this, the Healthy Weight for Children Action Plan also looks at the policy, legislation, and cross-sectoral action to support healthy environments within the HSE and working with external partners. So the basis for the development of a new plan came straight from the previous plan under Action Area 1, establish effective governance, implementation, and monitoring structures. Within that area, Action 1M, to prepare a 3-year action plan. So this process was started by the Healthy Weight for Children Oversight Group that had been established as part of Action Area 1 back in 2021. So pretty much exactly a year ago, in June 2023, from that oversight group, we conducted an online options appraisal with members of the oversight group, including the Healthy Weight for Children regional chairs who sat across the different CHOs implementing the action plan locally, and heads of service and health promotion and improvement on how to move forward from the previous plan, because the 2021 plan, a lot of good things had been achieved, but because of those delays that I mentioned, there were still actions that either had not started or were ongoing. So the key parameters that were decided upon was that we were not going to be starting from scratch, that we would be building on the existing plan. We called it a refresh at the time. We'd be removing completed actions, updating where focus had moved to a new deliverable, continuing relevant, ongoing, or not started actions, and to add new and emerging actions. And as you can see, the planning moved to a 5-year plan rather than a 3-year plan. This was directly from feedback to spend less time on that planning because you can see it took us a year to get here, and more time in that doing and actually getting the work done. The idea was also that we would be providing a framework for regional innovation and actions to emerge and to be integrated into regional area Healthy Ireland plans, which were consequently being developed this, now 2024 to 2025. So it was also around this time where we formed a working group out of oversight group membership and nominations. And as you can see, we're very on purpose having different levels from strategic to operational, from different participants from health and well-being, health promotion and improvement. We had the Healthy Weight for Children regional group chairs with EDA and Child Health Development Program officers. You can see here, Fiola will be speaking as well after me, and HPNI dietitians on this working group. And also with representation across the country with the different CHOs working together. So these are the people who, a lot of them are going to be implementing this on the ground. So it was very important to have their participation and everyone working together. So the next slide here gives an overview of the timeline and engagement to developing the plan. So as I mentioned before, last summer, we were doing the very beginning work. We formed the working group, held a scoping exercise building from the previous plan, which was then reviewed. This yellow bigger box here is where we went wider than the working group, where we did wider stakeholder engagement to identify gaps and priorities from the scoping exercise, which was then reviewed, and a first draft was prepared. And around the autumn of 2023, we had an in-person working group workshop in October where we prepared the second draft and had our final working group meeting in December 2023, where we shared the second draft and decided on an engagement plan to take the plan forward. At the same time, you can see here the Healthy Weight for Children oversight group that started this process was disbanded at the end of 2023 with the end of the 2023 plan. So things really moved locally at that point. In the first quarter of this year, we held briefings with the Healthy Weight for Children implementation group chairs on prioritization for their local outcomes within the plan. And everyone took that back to their local groups, which reviewed the national plan and agreed their local priorities for 2024. And here in Q2 2024, you can see I have this highlighted. We are in the process of establishing a new National Healthy Weight for Children steering group to oversee the new action plan. So just a note here, you'll see the gap between the oversight group being disbanded and the new Healthy Weight for Steering group starting progress on establishing that governance, on developing the new plan. And the stakeholder engagement information was affected by the forced industrial action over Q4 2023 and Q1 2024. But we persevere. We are currently finalizing and since checking draft of the plan. The idea is that the Healthy Weight for Children National Steering Group will formally sign off their tours and formally sign off the Healthy Weight for Children Action Plan in September, and we will be publishing the plan by the end of the year. So the action plan itself sets out the key actions to be undertaken at the national level over the period 2024 to 2028 that support and enable activity and responses at the regional level. That's separated out. We have those national actions, and then we have core outcomes regionally that are informed by evidence to guide regional groups in understanding the scope of their regional area activity and their prioritization of it. So those core outcomes will be a guide for areas on what they should be looking at when addressing child health and obesity prevention, both in practice and when developing those Healthy Ireland plans that I mentioned earlier. It provides for a level of coherence and consistency across local areas while also allowing for local innovation. It recognizes that areas have different populations and profiles, priorities, and resourcing and actions to achieve those outcomes will vary. So those are the different factors we took into consideration. We were trying to make it less prescriptive and a more of an open framework at the regional level for people to make their own. And also there was the organizational change and that move to health regions where responsibility for operational delivery primarily lies. So that's why we've separated it out and changed the structure to be a bit more open and responsive at the regional and area level. So just taking it back to that governance that we're establishing. So the Healthy Weight for Children Steering Group 2024 to 2028 will oversee the implementation. Hello? Oh, I am almost done. I can't see anybody in this moment. It'll be overseen. The purpose is to provide a forum to identify and mobilize enablers and also mobilize actions to address barriers to implementing the plan across all action areas. It will also provide a forum for shared learning between health regions and national and across health regions. It's also be monitoring progress on the implementation of actions and reviewing progress and prioritization of actions for year on year. I think I just have, this is just an overview of what that steering group membership is forming to look like. So it's taken a lot of the oversight group members are on here, the Healthy Weight for Children Implementation Group chairs that I had mentioned across the country, a lot of the national programs that are involved in implementing actions in the plan. And then we also have an oral health program representative, which is directly came from feedback. Again, that kind of collaborative whole systems health approach, getting everybody involved. Just one last slide is our next steps are to sign off and publish the action plan. So a link to the electronic copy will be sent to all registered for this webinar when it's published at the end, towards the end of the year. We'll also be doing monitoring and reporting on 2024 progress, and we'll be preparing for 2025 activity. And I am going to pass it on now to Ida and Fiola on how the Healthy Weight for Children and action plan works at the area level. Thank you.
Thank you, Veronica. Good morning, everybody. My name is Dr. Ida McDonough. I'm the Principal Medical Officer here in the Northwest. And I'm delighted to be here this morning along with my colleague Fiola Murphy, who is the Project Officer for the Healthy Weight for Children Local Implementation Group for Cavan, Donegal, Leitrim, Monaghan and Sligo, also known as CDLMS. Back in early 22, when I was first asked would I chair the Healthy Weight for Children local group, I actually jumped at the chance because it's an area I've had a very long-standing interest in. I even go back as far as 2005 when the first obesity strategy was launched by the then Minister for Health, Bertie Ahern. I also since attended Temple Street Hospital in around 2016 and spent a couple of days with the Weight to Go program and observing its multidisciplinary approach firsthand. And I've also had the chance to attend some of the COSI conferences around 2018, I think, before the pandemic. In our area here, in this region here in the Northwest, we are fortunate as we have an integrated child health committee in place, and that dates back to 2011. This is headed up by our Head of Health and Wellbeing, Cara O'Neill, and co-chaired by our General Manager, Emma Ball. Our Chief Officer, Dermot Monaghan, has a big interest in children's services and also attends our meetings regularly. The Regional Child Health Committee, as you can see there on the right, comprises of a lot of the heads of disciplines and a number of interagency and parents representatives. The Healthy Weight for Children local implementation group submits a report every quarter to the Regional Child Health Committee, and at our most recent committee meeting, I presented an update to that committee in March on the refreshed action plan, which will run up until 2028. So moving on, our local Healthy Weight for Children implementation group is composed of many senior HSE clinicians who work with children. For example, as you can see there, we've got public health nursing, dietitians, health promotion, physiotherapy represented, community medicine, children and young people services, the dental service, the acute pediatrics and maternity services, general practice nursing, lactation, and of course our network managers, the Healthy Communities projects, and our service user engagement is actually a work in progress, and we are working on that locally, even though we have received and incorporated service user feedback in our e-booklet, which we'll be looking at in a few minutes. So moving on, the task that the local implementation group have is that we support and monitor and oversee the Healthy Weight for Children action plan locally. I remember when I first got to read the action plan, I thought, gosh, there seems to be a lot in it. And I had to read it a number of times until I realised that really it sets about changing our culture, changing our mindset, and changing how we view and manage overweight and obesity. The aim is that we want to have a confident, competent workforce who can communicate effectively with all children and their families without judgment. So the ask, what is it? It's not big, it's not huge, but it is very important. And we ask that Healthy Weight for Children becomes everybody's business and on everyone's agenda and at every opportunity that it can be raised and at every event. In this area, we have identified our key priorities for 2024. We've launched our e-booklet, which we will have a look at shortly. We have our virtual subgroups in place, one in Donegal, one in Cavan Monaghan, and one locally in Sligo Leitrim. And we have engaged with local projects, including Healthy Communities projects and many more. A lot done, but there are gaps. There are areas where we need to work harder and smarter, in particular to reach and to ensure that those clinicians who see every child, such as our public health nurses, our GPs, our practice nurses, our school nurses, and our dental service, that they have the time to undertake all the necessary training and that they can be actively involved in our subgroups. I will now happily hand you over to my colleague Fiola.
Morning, everybody. So I'm going to just move on my slides there. Just checking that you can hear me okay. Okay. So I'm going to share with you over the next couple of slides how we're approaching implementing the action plan here locally in the Northwest. I want to, I suppose, acknowledge that the action plan has now been split into local and national outcomes. And for us within our local implementation group, this was a positive move because it really gave us focus and clarity about what was the work that was needed to be done, how we were going to deliver the plan, made it much clearer and much better structure on it. So we really welcomed that. So Ida received the action plan earlier on this year, and she called a face-to-face meeting of our local implementation group, which I'm going to abbreviate to LEAG, in March 2024. And at that meeting, our aim was to identify what our local outcome prioritisation was for the remainder of 2024. And once we did that, we were going to look at how we were going to implement those outcomes, how we were going to monitor them, and how we are going to report our progress. Within the action plan, there are 22 local outcomes from action area 1 to 4. But do remember, those local outcomes are for delivery over the lifetime of the plan, which we now know is 4 years. We discussed our outcomes. I'm just going to start my camera doesn't seem to be working, so apologies for that. We discussed our outcomes at the meeting and looked at those 22 outcomes in detail, and we looked at what was achievable for us for 2024. We took into account, first of all, that we were through the first quarter of the year at that stage, and also that we knew services were under huge pressure from the staff embargo. So, we need to take that into account when we decided what our outcomes were going to be for the year 2024. We already had some outcomes in progress from the previous plan, and we were bringing them forward into the new plan. So we were not starting from scratch there, which was good. We had made some good progress from the previous plan. So with all that in mind, we identified 16 local outcome priorities for us here in the Northwest for 2024. That sounds a lot considering there's only 22 in total, but do remember that we already had about 50% of them already in progress to varying extents. Some of them we were starting from scratch on. Edith already referred to the virtual subgroups we decided to create as well. And that was really to support implementation locally within the local health areas. And we allowed these groups with the integrated health areas, so that when the restriction starts later on this year with the health regions, that those virtual subgroups would be able to bring that work with them when they move into their health regions. And for us here in CHO1, we are losing Cavan Monaghan into the other regions. So by creating those virtual subgroups, they would be able to bring that, that work with them into their new region. I thought it was really important to bring this, bring to your attention the training that's set out in the action plan in relation to healthy weight for children, and it's quite significant. And it is part of many of the outcomes that we have to deliver on. So you can see there in the diagram that there are, in the amber color, there's 6 nutrition modules, there's 4 infant feeding modules in the green, and in the light blue, there's the growth monitoring modules, and all the education within childhoodobesity.ie. So it is quite significant, but we have to remember we have over the lifetime of the plan to get people trained up in all these modules. So for us here in CHO1, we have identified growth monitoring and infant feeding as priorities for us for 2024. We've narrowed that down even further, and that we're requesting, it's just the key staff. We really want the key staff who work with children to do the infant feeding modules and the growth monitoring where appropriate. So that would be our public health nurses, our pediatric dietitians, pediatric physios, etc., GPs and practice nurses ideally as well. But what we really want and really important is that all staff to be aware of those key messages, what the resources are and the signposting that they have responsibility to in relation to healthy weight for children. So I suppose if I was to give you an example, maybe a physiotherapy that's working with older persons, and she's seeing one of her patients at her clinic, and that patient is accompanied by their daughter who's breastfeeding their baby, and that daughter talks with the physio that she's having difficulty with her breastfeeding journey. That physio, even though they're working with older persons services, should be aware and know where to signpost that mother to for breastfeeding support. So that's really why it's really important that healthy weight for children is all people's business, not just those people working with children. So how are we going to do that? How are we going to support staff in that journey and in that signposting? So these are, as Ida has mentioned earlier on, we have 2 ebooks developed, one for healthcare professionals and one for parents. So this is our one for healthcare professionals, and if you're welcome to scan the QR code there if you want to get it, and it's also going to be available, the link for it will also be available in the chat. So Lauren, you can go ahead and open it up there. Thank you. So Lauren is just going to move through it. So as I say, this is our ebook for Healthy Weight for Children for Staff, which has been developed by our local committee with the support of our HPNI colleagues. We feel this is a pivotal tool in meeting our local outcomes. It contains all the Healthy Weight for Children recommended training, as well as resources and supports to help staff in their interventions with children and family. It's also going to ask, really importantly, as it's going to serve as a signposting resource for healthcare professionals to all the local supports and services for parents, and it includes QR codes to all those local supports and for parents. We feel this is a game changer for us in implementing our local priorities. We now have something really tangible to bring to service managers, to bring to heads of discipline, and most importantly, to bring to staff so they can use in their work with children and families. It's a dynamic resource, so we can constantly update it, and we are constantly updating it as new resource and supports come out. And similar designs on foot of this, there's similar designs in progress or in design or have been designed around the country, similar to this ebook. So thanks for sharing that, Lauren. And I'll go back and share my screen again. Okay. So that's the healthcare professional one. I want to show you the parent one now. This is our parent resource. Now, we don't have time to open this up here today, but you can scan the QR code and the link for it will also be in the chat. We've called this one Health and Wellbeing for your child and young person. We initially had called it Health and Healthy Weight for your child, but we did receive some service user feedback from a parent who had a clinic appointment with the community medical doctor and was looking for some advice on dental. And the community medical doctor did signpost her to the ebook, and the parent fed back that she never for 1 minute thought that she'd find a dental resource within a book that was titled Healthy Weight for your child. So we took that feedback back and we changed the title to it to Health and Wellbeing for your child and young person. And that gave us a lot of scope that we could bring in so much more resources in relation to infant mental health, child and young people's mental health. And we know these factors can impact on the health and weight of a child. So there are 2 resources for signposting. So, okay, so now we have our priorities, we have our resources. What's the next step? There's no point in having resources if staff don't know about them. So this is the huge part that I can't emphasize enough, the importance of the stakeholder engagement and communication in relation to local implementation of Healthy Weight for children. I've been working on this for the last 18 to 22 months. And what I've noted, what I've learned is that you need to engage face to face with services. You need to re-engage, re-communicate to keep it on the agenda. Services are so busy with everything that's coming on their plate. Healthy Weight for children might be at the top, it very quickly moves down the level of priorities. So you have to keep re-engaging with staff, with service management at every opportunity you can get. So you can see on the left-hand side, that's the engagement we've been doing at the moment. We have really good engagement with our paediatric maternity services. They've really bought into this. We're really working in an integrated way with our acute sector because we know that everything to do with healthy weight starts from those early years. We also have to start thinking outside the box. How are we going to reach wider staff like GPs, practice nurses who are critical to this? So you can see the work we've been doing there on the right-hand side, embedding the Healthy Weight for Children training into GP training schemes, into student nurses. We're doing a nice piece of work at the moment, embedding the QR code to the parent ebook, trialing it on scheduling letters to parents from Sligo University Hospital and community medical team. And we're using all the comms to do with HSE as well. So how are we going to report and how are we going to monitor? Reporting is twofold. It's biannual to the Healthy Weight for Children steering group that Veronica talked about, and locally 3 monthly to our chief officer through our child health committee. We're going to measure it through our HSE land completion rates that come nationally from the Healthy Childhood Programme. Look at the number of clicks on our ebooks and our hotspots that are related to that. So far on the parent ebook, since its launch, we have 23,500 pages viewed on our parent ebook. We're really happy with that. We can do better. We're going to look anecdotally, take feedback from our staff, our managers on a local level and from our parents. And we're also going to embark on some staff and parent surveys as well.
So just to wrap up and summarize what we have found to be really important in our area. So the good and strong governance coming from our executive management team, that's key. A passionate committee who is committed and engaged in the Healthy Weight for Children programme. We've identified our key priorities incrementally for 2024, and we will do so for the following few years. And in particular, we are keeping and trying to keep healthy weight for children on everyone's agenda. The work is ongoing. We have to keep chipping away at it until it's embedded in our minds and in our practice. Thank you very much, everybody.
Off there. Thanks very much, Ida, Fiola and Veronica. That was a really excellent presentation. I'm not going to take any questions live, but we've had a good number of questions in the chat that we're responding to. But it was an excellent, I think, illustration of how in some ways, the new world order in the HSE will work now in terms of ourselves, the Healthy Childhood Programme, the Healthy Eating Active Living Programme at a national level, enabling, supporting, monitoring and performance, and then at a local level, you really taking that operational focus and integrating it. And I think the other really key thing that came across from me from what you were saying is, you know, it's very difficult to separate obesity prevention out from all child health work or child health promotion work, because ultimately all aspects of children's health and well-being and development need to be, you know, connected and supported for children to grow and to thrive over time. So fantastic work there in CHO 1, and I know through our steering group and also other work that there's a, you know, an absolute intention for supporting that learning and sharing across the areas, and there are other areas who are doing really innovative work like this as well. So thank you very much. So we're now going to move on to our panel discussion. So I would like to welcome to the screen Dr. Anne-Marie Horahan, Dr. Slee Murren and Geraldine Sexton to talk about our theme, which is supporting parents to talk with their children around weight. We held a webinar recently to mark the launch of a guide on talking about children's health and obesity, which was about improving our, trying to improve our communication skills in terms of advocating for policy and environmental changes, and how we can better frame and speak about obesity to achieve those benefits. But many of the participants on that webinar were also asking for tips and guidance on talking with parents about their child's health and weight. So that's, you know, why we thought this was a really good opportunity to look at it. So just maybe to introduce our panelists a little bit more. Dr. Anne-Marie Horahan is a senior clinical psychologist with the Changing Together new community-based specialist weight management service for children and young people in Waterford. Geraldine Sexton is a project dietitian with lots of experience in many areas, but who she's been working with the Healthy Eating Active Living program for a number of years, and has been very involved in the design and development of the care pathway and resources to support the Changing Together service, as well as a number of other projects. And Celine, you have met already, so so welcome, ladies. Just maybe to start, Geraldine, I might come to you first. At the webinar earlier this year, when people were asking for tips and guidance, we were saying to them, yes, we have something in the pipeline for you that will help. It's coming soon and it's now here. That's the Talking with Your Child About Weight booklet. So could you tell us a little bit about where it came from, how it was developed, and I suppose what it does?
Yeah, sure. So as you say, through conversations that we're having on the ground in clinical practice, and also from the research that we did when we were designing the weight management service for children and young people, it was very, very clear that parents and even healthcare professionals, that they're not confident in initiating or having conversations with children and families about health and weight, and that there was this real need for an evidence-based guidance to help them to have open, positive conversations about health and weight. So it was for this reason that the Healthy Eating Active Living program set this as a priority project for 23-24. And when scoping the project and agreeing what this resource would look like, we agreed, and when I say we, I mean the project team, which included key stakeholders in child health and weight. What we agreed was that the aim of the project would be to develop a resource or a booklet that would support parents and caregivers in terms of their confidence in talking about weight with children and healthcare professionals, and reducing potential anxiety and distress when their child is above a healthy weight. And also another aim, I suppose, was to support healthcare professionals in terms of their willingness and confidence in talking to parents about children's health and weight. So the initial steps of the project involved collecting and collating existing research evidence, exploring the different types of weight and health communications between parents and children on children's well-being. And very, very early on in this project, or that stage of the project, I attended the European Congress on Obesity in Dublin. And there I met Fiona Gillison from Bath University, and she was presenting their work on the same topic, talking to your child about weight. And to say it was impressive is an understatement. Her team had been, they had conducted very, very robust research in this area. So what they did, just to go through it very briefly, is they had a mixed method design where they collected data from 2 previously published systematic literature reviews to identify the association between parent-child weight talk and broader health discussions and children's well-being. They also conducted interviews with children, both in the classroom setting and on a one-to-one basis, so through Zoom. And they did a bit of work as well, developing and refining narrative messaging. So this is a sort of a communication technique where parent-child interactive scenario is described, and it just helps parents to identify themselves and their situation through a story. And then using the insights from all of their research, they developed their own resource to support parents on what to say and how to say it. Now, just to highlight the depth and quality of this work, and I'm sure what I just said just did that, but just to say, like, their project team was made up of 28 different experts. They had members of the public, they had public health specialists, they had GPs, dietitians, psychologists, they had people working for eating disorder charities, and they had academics as well. So there was a huge amount of expertise involved in that process. And we're actually going to drop a link in the chat there for people if they want to do, just to read a little bit more about that work that they did in Bath. But having heard all this and going back to our team, we made a decision: why repeat what has already been done and been done so well? So we spoke with Fiona and her team, and we sought permission to adapt their resource for the Irish population. And they were delighted for us to do that. We had a little bit of work to do. There were some cultural differences, so we looked at it from that perspective. We were also working with Frameworks UK at the time, who are a communication research organisation that were helping us to reframe all of our messaging to make sure that it's more effective. So we give them a near final draft, I think that's penultimate, is it? A near final draft of the booklet so that they could review it and see, did we need to make any more tweaks? And we then just did a check as well to make sure that our messaging was consistent across all of our resources for healthy weight for children. And then finally, before we went to print, we engaged with the Changing Together specialist weight management teams. So there are new teams in CHO 5 and 7, just to get their input as well, just before we signed off. So even though we adapted a booklet that was already, a lot of the work had already done, it took us a good while. And in March 2024, the Talking to Your Child About Health and Weight, a guide for parents and caregivers of children booklet was launched. Now, it is, I know I seem biased, but it is a fantastic support. It covers topics like, should I talk to my child about their weight? It goes through, the importance of a whole family approach. It gives tips on how to start the conversation, which really helps parents and caregivers have those positive conversations when needed. My favorite part is a what can I say when section. So the booklet gives examples of different ways parents and caregivers could phrase what they want to say to their child. So when they're feeling a little bit nervous, a little bit anxious, not too sure what to say, there's conversation starters there, and it is actually really, really helpful. So we've had an amazing response so far. Everyone is really positive about it. And the booklet, I don't know, can you see it? Not really. But this is what the booklet looks like. It is available now to order on healthpromotion.ie. We will drop a link in the chat to that as well. When you go to healthpromotion.ie, you won't be directed straight to the page. So just go under the tab for child health, and then you can order from there.
Wow, fantastic, Geraldine. That's a really comprehensive walk through the process, and it was really, really great to be able to leverage the work that had been done in the UK, because if we were to do the same depth of work here this time next year, we might be talking about having a resource for people. So it's really fantastic to have that, and hopefully people will find it really useful as well. Celine, can I come to you? Like, one of the pieces and the things that we would have had conversations about it with Geraldine and the project team when in developing a resource was the whole area of stigma and language, particularly for children and young people living with overweight and obesity, and also I suppose, you know, in some cases other family members will be in the same situation. And talking to healthcare professionals, then, like, we know that, you know, people are, there's been a lot more education around it, so people are more aware of it, and people don't want to cause harm or offense or damage, and this can cause us people as our health professionals to be nervous about broaching the subject. Now, I know your team recently did some research with children and parents who had taken part in the COSI data collection. So, you know, that's you know, where children are being weighed and measured and data collected and that. So I wonder when you were in those conversations with children and parents, you know, and when it came to weight and that, what were they saying, or did they have any?
Yeah, so we did this piece of work because, again, we were hearing anecdotally around the concerns that people had that, you know, by measuring children in schools, that you may be stigmatizing them, that you may be causing, you know, issues in terms of their anxiety or mental health and well-being. And so obviously we wanted to make sure that that was not something that was being experienced by children in participating. And interestingly, that Geraldine mentioned Fiona Gillison, we'd actually worked with her to develop the protocol in relation to doing this piece of work with children. So we conducted some paired interviews with children. And again, we did a storyboard type of approach whereby we were taking them out of their context. It wasn't about them personally, but it was about what do you think children might be experiencing by participating in the COSI study. So it was very much a step-by-step, you know, what happens when your parents are invited to participate? You know, how do you feel about being consented? So it was really walking through each stage, and then right up to the point of, you know, what do you feel like when you're in class and your teacher calls your name out? And so this was the kind of idea we wanted to get through around what they might have been feeling in that period of time. And again, they were different, a boy and girl, given different sort of pseudonyms in terms of trying to elicit what they might be feeling. And I suppose what we see interestingly is that, you know, children experience different levels of fears, obviously, and there's some children who love being called up outside of class and love being taken outside of class, and others don't. And they have, you know, various different emotions associated with this. And some of it is simply the fact of being singled out, of being taken out of a group setting. And whereas, you know, the actual experience of being measured is not something that they necessarily perceive as being negative on their emotions. However, they do reflect on other children, and they do reflect that there are children who may be a little bit more, the language they use was things around self-conscious. They may feel more self-conscious about themselves. And I suppose, interestingly, it's not just self-conscious about their weight, it might be self-conscious about their height, if they're smaller, if they're, you know, so there's lots of different things that children are experiencing as part of that general process. What they did comment to us, though, was in relation to the adults in the room. So the researchers doing the measurements is, you know, they talk about their demeanor and their language and how they present themselves, and that was something that was really interesting for us to learn. I mean, our researchers are trained very much to try and avoid any type of negative impact that they may have. But I suppose in some instances that may be taken that they're so formal that the children maybe need to feel a little bit more relaxed about being in those types of situations. So it's really about making it comfortable. And as mentioned before by Geraldine, it's that use of positive language. This is about your health and well-being, trying to take it out of that kind of body image and body conscious type of thing. This is about health. This is about well-being. It's a positive thing, and to look to see how can we build on that and how we improve on that type of language and discussions around that with children. And I suppose in terms of the school setting and the class setting, you know, trying to remove that issue around that weight is something that is a negative thing. And I feel we have decades, we have a legacy of problems with weight in not just the physical side, but just the language around weight and it being value laden, and this idea that it's your fault and it's individualized as a problem. And children hear that and they pick up on that, and we need to really start changing the conversation and the narrative around that.
Thank you, Celine. I know, talking specifically about the experience of from the school setting, but some really nice insights there that people may be able to pick up and translate into into the healthcare setting. Anne-Marie, just coming to you there, the other piece we hear from health professionals is a concern about not damaging relationships, you know, so whether they have an existing relationship or whether they're starting to build a relationship with parents, that, you know, maybe bringing up the issue of weight or the topic may have a negative impact there, and like they could be they talk about dealing with either the extremes of an overly anxious parent that they're trying to manage, or, you know, a parent who seems to be blissfully unaware, or even to the more confusing piece of parent that they know is aware but actually is like very clearly signaling, don't go there, don't have the conversation with me. I wonder, I suppose from your practice in Changing Together, but also kind of your wider psychology practice, are there any tips or guidance for people in those situations?
Hi, everybody, and thanks for that, Sarah. I just want to reflect, first of all, I'm really encouraged by the number in the audience here today. So it obviously shows that people are interested in this area and curious about it. And look, I mean, from being in the front line of having to talk, because I'm in a weight management service, having to talk to parents about their child's weight, it is a very sensitive topic. But what we bring into the room as clinicians is also really, really important. So becoming very aware of our own biases, similar to what Celine said, you know, we have a legacy of thinking about weight and weight-related problems. And really, it's a health concern at this point. It's nothing to do with blaming parents. So I suppose the first thing we have to do is make sure that we avoid blaming parents and bringing them on board as being part of a solution rather than part of a problem. And then focusing on healthy behaviors, because weight and health are, they're sides of the same coin, really. And I suppose for me, it was really about bringing up or reflecting that I had a health concern. And would it be okay? And seek permission from the parent to talk about the child's weight. That's a really respectful thing to do. Is it okay today if we talk about your child's weight? Is that something that's concerning you? I've noticed it as a health concern I have as your practitioner, and I wondered, is today a good day to talk to you a little bit about that? 99 times out of 100, a parent will say yes. I have yet to meet a parent who won't talk about it. Do you know what I mean? So I think you're kind of pushing an open door there when you talk about it in terms of health. Parents are not expected to be perfect either, and that's important to kind of reflect back to them. You know, there's no such thing as a perfect parent. Do you know what I mean? And certainly, you know, we all make mistakes, we all make wrong choices, and food choices are really laden with judgment as well for parents. I mean, how we first parent our child, how we're first judged in terms of our parenting, how we judge ourselves is usually related to the feeding of our child. Do you know what I mean? So it's really important to kind of reflect that, you know, and then we can talk about how we can actually do something about a child's weight as well. So parents can we can speak to parents or other about the actions that we can take. We don't just have to sit on this problem, you know, and oftentimes parents, again, really want to know, what can we do? And for an anxious parent, they can often feel very overwhelmed. So it's about making small incremental changes over time. For some parents, it's about kind of raising awareness that this is actually a health concern. This is nothing to do with the child's appearance. This is really just about how do we get, like, every child is entitled to live in a healthy body, you know, and how do we kind of work with the parent toward that?
And I suppose, Anne-Marie, just one of the queries in here from the audience today is, you know, as a clinician, you may have the parent and the child in front of you, and you know, what would your general guidance be in terms of, you know, discussing the weight as an issue in front of the child, with the parent and child, or how might you consider that?
I mean, Again, I think, we're going to be meeting this over and over in clinics. I mean, the stats are in, and we know from the talks today that 1 in 5 to 1 in 4 children in certain areas are going to have a weight problem. So I suppose as a clinician, we need to be okay to talk about this. Actually ourselves. I think our own nervousness and bias, we have to kind of address that ourselves. If we're okay with talking about it, we can reflect that to them. I'm okay with talking about this today. This is what we do for a living. We are health practitioners. So is it okay for us to talk? To be honest, children are already sensitized to this stuff, they're already getting messages about their weight all over the place. So even asking for their opinion and asking for their input, what's it like for you? What are your thoughts? All of these programs in school, they are hitting the mark in terms of, they're able to talk about healthy food now and activity and things like that. So it's really about drawing them into the conversation and just having an open conversation. And try not to be too nervous. Your intention is not to be rude or, to label children in any way. And you can make that clear, but it's really a health conversation. And we're talking about your health today. And as part of that, it can be about weight. It can also be about sleep, for instance, or, breathing difficulties and things like that.
And I suppose, where parents have an awareness, or when you've had that conversation, the resource that Geraldine was talking about is a really nice tool for health professionals to use to encourage the parents to have that conversation, or to continue the conversation at home if needed.
It is, and actually it's really important to talk about it as a family issue. Do you know what I mean? I mean, we know from working on the other end of eating disorder behavior that the family has to be on board. It has to be a family-based approach. And honestly, in my experience, the children quite enjoy it when the family are involved. They enjoy learning about food with mum and dad, doing exercise with mum and dad. Even they like a little bit of competition with mum and dad as well, So yeah. They can all form part of the intervention, I think.
Yeah, no, and that's great, Anne-Marie. And I'm just noticing the time, people, we've run a little bit over, but I think it was really great to have that kind of opportunity to touch on some of the issues that people had raised for us before. So again, we would encourage anyone in the audience here to order that booklet and to think about how they might use it in their practice to support parents. So thank you very much, Celine, Geraldine and Anne-Marie for that discussion. And I'm going to hand over to Anne Purdy from the Healthy Weight for Children programme to wrap us up today.
Thank you very much, Sarah. So on behalf of Child Health Public Health and in partnership with our colleagues in Healthy Eating, Active Living, I have the pleasure of closing today's webinar. I am so struck by the energy, I suppose the level of engagement, and certainly the learning right up to that very last moment. I really feel that today's webinar brings together many of the really key ingredients in terms of implementation, and that's crucial. It's crucial for, I suppose, from a central policy level, but also equally and more importantly, for those practitioners and staff working in very local communities, because this is where our children and families live. I want to extend a very sincere thank you to all of our presenters and panel discussion, and particularly our organising team in terms of just how smoothly today's event has gone. Perhaps to start with data, and I suppose we so frequently speak about being data informed in what we do. Celine and colleagues, just a huge thank you to you around just the depth of the work with the COSI study. I think there's much learning. I think I would very much encourage people to read the full report. It cropped up a lot there around participation. And I suppose from a child health perspective, we're in broader bodies of work. You've actually done exceptionally well. Engagement and participation in a busy school environment is extremely challenging. Schools have an awful lot coming at them. So actually, I would really compliment you on the process there. And I think there's a lot of learning for those implementing maybe local initiatives and engaging with schools. I think it's reassuring to hear the policy and government commitment from Minister Burke. we all should be actively reviewing frameworks like I suppose the first five whole of government strategy. We should be looking to the work of the Child Poverty and Wellbeing Unit within the Department of the Taoiseach. We should be looking at some of these really fundamental policy changes that are needing and advocating with those. Particularly, we've all got elections coming up shortly. We'll have politicians on our doorstep. We need to be advocating for some of these huge fundamental changes. Veronica's presentation on our action plan, as she outlined, this has gone through a number of iterations, a number of quite a lot of learning in this very broad, complex area. We really hope that this will guide and help support implementation across national and local level. And I suppose this was very effectively brought to life in the presentation from Ida and Fiola. You really bring this. I was so struck by how future-proofed your implementation is around even the reform within the health services in new regions, but also dynamic materials and integration. And, life is busy. Life is busy for parents. So you come into an appointment, an opportunity for a takeaway message, perhaps about dental, perhaps about sleep, even if you're in for some other interaction with the health service. These are incredible opportunities where the practitioner is busy, but the parent has a chance to kind of come away, and perhaps on the way home you have a moment to think about, gosh, that's something I might actually be able to do. So that collaboration, that consistency of messaging and opportunity to reinforce, it's not for the faint-hearted, as they explained. I mean, it is quite a challenging communication exercise. And then finally, piece that I was hanging on to every word for as throughout this whole session was this section around communicating and having these difficult conversations. Geraldine, the resource that you introduced to the group today, I think, is going to be so invaluable. We would know from engagement with practitioners, feedback from public health nurses, community medical doctors, a variety of practitioners over the years. Raising these conversations are difficult. So the depth of research and the collaboration with colleagues in the UK is really welcomed. Also, in terms of the panel discussion, I think some really valuable tips and I suppose some helpful understanding around what, we talk a lot about stigma. We talk a lot about the difficulty of raising conversations, but I think as that discussion brought forward, it is really about just feeling confident in your professional skills for practitioners to say, this is about health. Is this okay? Participating with parents, engaging with the parent, asking their permission. And finally, to our attendees, thank you so much for joining with us. I've been fascinated with the numbers and the numbers retained in the middle of a busy day. They often say it takes a village to raise a child. We know that in this very complex, changing world, it takes a village, town, city, it takes the nation. We really welcome your engagement. We would encourage you to access all of the resources. We welcome feedback. We're constantly learning, so we would welcome any feedback, and the Healthy Eating, Active Living email, or indeed directly to Healthy Childhood, would be very welcome. So on that note, and in the subject of the day, I think it's probably time for everybody to have a stretch break and practice some of the messages that are in some of those wonderful resources. So thank you very much to our panelists and our audience today. Thank you.